Right, we are going to be talking to Dr. Ong'ech Odero from Kenyatta Hospital, and he is at the INM studios, and we just want to get the perspective of someone who has seen how the system works to shed some light on this issue of negligence in public hospitals. So let's go to our INM studios now and speak to Dr. Ong'ech Odero. And like we said, we're talking about the public health system and what is the problem with it. As we've seen this evening, another incident of negligence in Nyeri, where a mother's baby dropped to the ground a few minutes after she gave birth. So Dr. Ong'ech, one of the things we want to find out is, what is the problem? What is broken? What is wrong with the public health system?
Yeah, thank you very much. I think the public health system is definitely ailing. The kind of negligences we are seeing are really unacceptable. But the big picture, as you've heard, I think, is we have a lack of enough human resource. The financing of the healthcare system is not receiving adequate attention as we should, as it should be. As you know, if you look at the World Health Organization, or what is a budget declaration of what the budget in the health sector should be, and all that is not adequate. So we have inadequate staff, infrastructure, equipments, and a variety of many things, ailing the sectors. So it's time that I think we need a dialogue, and we need to make it. The few health workers who are there have a burnout. So this is, you're seeing a burnout, and the cases you've seen there are, like we have free maternity here, we have upsurge of people coming to the hospital to seek care, but we haven't really addressed it by even employing enough nurses to address this issue. So I think something needs to be done urgently to address these things.
Right, you've talked about a lack of enough resources, enough manpower, but there are some situations where it's not necessarily an issue of a lack of manpower. For instance, in Bungoma, where patients are being mistreated, that's not necessarily an issue about a lack of manpower. So is there, do you think, a deeper issue as well?
I think we are dealing with a demotivated workforce where, we have the burnout. Of course, this is attitude problem. So when you have a burnout among the health workers, the few staff are there, then eventually they have attitude. And so the bad attitude is probably definitely to blame for some of the obvious negligences we are seeing. But this is really, as I do think, as a result of burnout. So yes, the health workers should also be held accountable. Some of the incidences we have seen are unacceptable, definitely, and somebody must be held accountable for that. So we also, on the other side, there's less accountability among the healthcare workers, something which really needs to improve if we were to improve the health services in the country. So I think that needs to be addressed.
Okay, definitely. So we've talked about an attitude problem as well as a lack of proper resourcing. But whose problem is this to solve? What do you think is the way forward? What can be done immediately to turn this situation around?
I think what should be done adequately is to really listen to what the experts in the field are saying. I mean, you've seen several strikes in the health sector. The issue around devolution of the health sector, which of course in the constitution. So generally the health workers are not happy people. So we need to really engage urgently so that we see a way forward. But most urgent quick fixes, I think things like employing nurses in things like addressing what the free maternity, giving resources down there to address the issue of the funding, because most of this you are seeing around maternal child health. A lot of this problem you're seeing them around maternal child health. And I can link them remotely to the upsurge in the free maternity. And I don't think, I know some money probably has been sent out there to address the issue of free maternity, but I think not enough has been done because there were health workers which were to be employed. there were supplies to be sent down, but then we've been caught up in this issue of devolution debate and the strikes. So I think we need urgent dialogue to see a quick fix, but what is most critical is the issue of the human resource. I think we need to employ nurses and health workers to address this. This is the big thing, is health work, and then the attitude problem, the burnout, which is the root cause of the attitude problem, probably will get better. But they need to be supported. We need probably maybe more counseling services to help those workers health workers who have a burnout, so that we get back on track to reduce these bad incidences. And of course, definitely, people who have caused obvious negligences need to definitely be punished.
Right, so let's talk about the issue of pay, because that always comes up whenever we have a discussion about the public health system. Do you think that increasing pay is actually going to solve some of these problems, like the attitude problem? Because much as someone may be earning more, is that heart to serve people? Is that sincerity with which they took the Hippocratic Oath something that is going to be brought about simply because they're earning more money?
No, I think we all know that to motivate somebody to work, money is a good motivating factor, but probably it's not the main driving factor to really make somebody work. Even if you increase the pay, I don't think that will be the solution. But health workers, like any other human capital, need to be managed from that perspective. They need to be recognized of what they are doing. They need to be rewarded. They need to be, promoted. They need to be listened to. So it's more of looking at it in a holistic manner, in a way that you can motivate. I don't think money, increasing the pay, is a quick fix for changing this attitude, but more so of recognition, listening to them, rewarding them, and managing them as a human capital, human resource and human capital would go a long way to improve things. But right now they feel neglected, they feel demotivated. For instance, even there's no housing. We have some of the very good facilities here installed in the city, and you find there's even no house for them, and nobody wants to listen. So I think it's listening to the small little issues they are raising probably will go a long way to address the attitude problem and motivate them, and rather than even just a quick fix of the pay. I don't think the solutions lie on heavily increasing the pay, but small little motivations.
Right. Thank you very much for sharing your insights with us this evening, Dr. Ong'ech Odero.